your people have had a lot more cash. Is it proving tricky to spend it and solve this waiting list problem?
Well, good to see you again, Alistair, and thank you for having me on. So the answer to the question is that money is one of the factors that will influence how quickly we can get through the backlog. Another factor is availability of workforce. And the reality is that we have 93,000 vacancies in the NHS, and that unless we can fill those vacancies, which will take us some time, that will be a rate limiting factor. But look, I think it's really important to start by saying that every single trust leader is absolutely aware of the moral imperative of getting through this waiting list as quickly as possible, because we know that, it's very easy to talk statistics. I thought your excellent introduction set out lots of the issues very well, apart from one thing, which I might come back on a bit in a second. But effectively, just let's remember that behind all of those statistics, there are people who are in pain, and there are people who, if we can't get to them quick enough, then effectively they do suffer the risk of not being able to go back to work. They suffer the risk of long-term permanent disability. So we absolutely know how vital it is to get through this. And actually, Alistair, the one thing we are doing pretty well at the moment is we are actually recovering our pre-pandemic levels of activity really very, very well. We're very, almost back to where we were before the pandemic. The problem we have in many places is that we have to ensure that we protect patients from infection risk, COVID infection risk. And that means we need to, separate out elective activity from urgent and emergency care activity. And that makes hospitals, by definition, less efficient.
I find it fascinating that you choose the word about moral as an imperative, and that's very refreshing to hear, because I think sometimes people feel that it can become a little bit like a conveyor belt, but in reality, all of those numbers that I mentioned and that you mentioned are people. Adults, children, men, women, everybody. You mentioned the real problem with workforce. And I hope you'd accept that getting money from Her Majesty's government has not been a huge problem. I hope that wasn't the bit you were going to come back and argue with. But you can't simply pick nurses off the shelf or gather up doctors, because presumably the vast majority of those who are qualified to do those jobs are there doing them right now.
They are, but the issue is that we clearly need to expand our capacity, and that's one way of kind of doing this. So we know that when we've had these waiting list problems in the past, like we did in the early 2000s, part of the answer is to put in temporary surgery capacity. I was talking to a trust chief executive who was about to spend £18 million craning in 2 mobile elective surgery units. We also know that we need to encourage and support our staff to work as much overtime as possible, though to be frank, we are in real danger of burning out some of our staff. We also know that we need to ensure that we use the capacity that sits in the private sector as effectively as possible. The independent sector, we know, is capable of doing some of the heavy lifting here. But I think the issue is, and you may have seen some of the media coverage of this last week, Alistair, is that that's not going to be enough. We're going to need to go further. We're going to need to be more innovative. And that's why we are looking at things about, can we get hospitals to work together so that people, if you've got full capacity in one hospital, but a hospital 20, 30 miles away has got spare capacity, could we work with patients to support them to go to, the hospital that's got spare capacity? Making sure, by the way, that we don't exacerbate health inequalities. So it's not just a question of people who can afford to drive between the two.